Hello, everyone. Wow, that music is loud, but we are here, we are live, and we are feeling ready to take your calls. This is the Transatlantic Call-In Show, the place where you get to call in and ask any and every question that you have about transgender people, and your hosts are always going to be two trans people as well, so you can hear directly from the source. A source.
Because we speak on behalf of all trans people.
Exactly.
Every other trans person is wrong except for us two. So I'm going to take that authority and probably abuse it.
But I am Arden Hart, and with me today, we finally got him back from his busy duties.
I'm back. I'm Dr. Ben. I'm in residency, and it's been a lot, but I got off work at a reasonable time, and so I figured I'd at least, show my face here again, even though Arden and Katy are probably just like, no, why is he back? Like, we planned this out so he could go to residency and leave forever, and I'm back, bitches. So,
I mean, we do audibly groan every time we have to have you on a show. It's like, oh, man, him again, but, no, I'm just kidding.
It's fine.
So, yeah, why don't you tell the audience a little bit about what you've been doing? And I know you're gone. You just said you're in residency, but like, what does that look like? Like, what's been up?
Yeah, right now it's chaotic, just kind of getting into the swing of things. But I'm on an easier rotation right now, so I'm just finishing up a month of clinic, and then I'm going to go into a week of geriatric clinic, and then another week of just regular clinic after that. So I've got a little bit of more kind of chill time. But I also, on top of that, am active duty. So I've been doing a lot of Army-related things as well. So kind of balancing all of that together. I just took the ACFT yesterday, so my muscles are absolutely dead. But I passed it, so we're good. But then after these next couple weeks, I will be on inpatient for the next few months. So I wanted to try to get on the show while I still had availability, because it's gonna be a little while before I have the energy to do this again. So,
yeah, well, I am so glad you graced us with your presence. Hold on, I want to get our name tags up. Again, I didn't do this, get them ready beforehand, because
you're busy.
Because I'm busy, and because we're not going to do a poll today. And we're going to talk about why. Wow, I can't believe I just did that. Oops, let's try this one. There we go. Might have to cut that later. So I want to talk about today in front of Congress. There was a hearing that was called the dangers and due process violations of gender affirming care. So this was in front of the House Judiciary Committee. The majority party, the Republicans, wanted to have a hearing on gender affirming care for minors and why it is, in their opinion, problematic and maybe should be banned at a federal level. It was, I didn't see all of it. I saw very limited amounts, but it's important, and I think we ought to talk about it.
Absolutely.
Yeah, so I'm gonna probably talk a lot. I want to give Ben a chance to jump in here in a minute, but I want to talk about the first opening statements that we heard from both the Republican and Democratic Party on this. The first person to make an opening statement was Representative Mike Johnson from Louisiana. He's a Republican, and his lack of an argument, it was not an argument, but his attempt was basically to assert that parents deserve rights over what their children are doing and what they're being taught, and that if it was up to the left, the state would make all the parenting decisions on behalf of parents, and would harm your children if they were allowed to. But if parents are supporting of gender affirming care and actually follow the evidence, in this case, they have to acknowledge that parents don't get full authority over their children at all times. And he used the example of, you can't just ignore seatbelt safety laws as a parent. You have a duty to protect your child from harm. So it's interesting that he used two completely contradictory arguments about parenting literally in the first 2 minutes of him speaking. And then he finished his very short and empty opening statement with The science is on the side of what we all know deep down is morally and ethically right. I want to point out that he made no argument for what the science is on the side of. He made no case for that. And he made no case for what any of us agree is morally and ethically right. He made no attempt to show like, the majority of people support this decision, nothing like that. The only evidence he presented in his opening statement was an edited clip of a doctor who performs genital surgeries for trans people, who spoke about how there is now an increasing situation where patients that are being referred for genital surgery have undergone pubertal suppression before. The doctor did not say he was operating on the genitals of children who are currently being puberty suppressed, but the clip was edited to make it seem like that's exactly what he was saying. The Representative Mike Johnson called this barbarism and said we should all be disgusted by this. He made no actual argument. It was just horrific. But the Democratic side of this, I think she did a fairly good job at her opening statement. This was Representative Mary Scanlon from Pennsylvania. She initially started by acknowledging that every major medical organization supports gender-affirming care. And I made this little thing quick before the stream. Sorry, Ben, it's going to roll over your face like the old credits used to. But this is a list of not even all, but most of the organizations that have made public statements affirming gender-affirming care for minors. You can see there are many of them. Most of them are probably extremely familiar to you, ones that you've relied on, or the doctors who are a part of them, you've relied on them for just about everything. It's cycled through a couple times now, but there was over 30 medical organizations in the original list. Some of them are specific to Texas, who have explicitly stated that they support gender-affirming care. And we're going to read some of those statements in a minute. I want to have Ben a chance to answer something, but I want to finish what Mary Scanlon was talking about before I have Ben talk about that. Okay, so she mentioned that... wait, is this the actual quote from her? I want to make sure I get this right. Holding a hearing? Yes. Okay, so one of her quotes was about how, so every major medical organization supports gender-affirming care, but here we are holding a hearing to substitute far-right ideologies for parental judgment, and it exposes the rank hypocrisy of the party claiming to value individual freedom and small government. So she is rightly pointing out that in contrast to their stated values of individual freedom and small government, they're interested in interfering in the rights of children and parents, and to criminalizing doctors for following evidence-based care. And while they decry that the left wants the state to be your parent, they are literally asking for the state to interfere with the medical decisions agreed upon between doctors and parents across the country, across the board. And so she said, and so here we are before the subcommittee on the Constitution and limited government. Basically, her opening statement was just acknowledging that this whole thing is farcical, an attempt for the Republicans to get constituents to the polls because they think that their representatives are actually defending their values, even if they are against the science and against the evidence. So in a minute, I'm going to read a bunch of statements from those medical organizations, a few of them that I showed you that just scrolled up on the screen. But I wanted Ben to talk about something because I think we mentioned this a lot, that like every major medical organization supports gender-affirming care, and we list some of them from time to time. But I don't know if everyone necessarily knows why it matters that the American Academy of Pediatrics or the American Heart Association might make a statement like this. Can you help us understand what these organizations are, what they do, why we should care what they have to say?
So each of these organizations, they are for basically the representation of all of the physicians in that specialty. So they are meant to communicate and lobby particular ideas and like positions to specifically political leaders, but also to the community related to certain issues that kind of pertain to that specialty. So we all know that doctors are very bad at communicating on their own behalf, and they're often very busy and not very well media trained and not very good at speaking on the topics that they like advocate for. And so what these organizations do, they're run by physicians. In the cases of the physicians organizations, of course, the nursing organizations are run by nurses and all that, but they have professionals from that field who know how to communicate and who put all of their work into communicating to the public and to political leaders about what the perspective is of like that specialty of medicine. So it takes the data that we know from the work in the research and in clinical medicine, puts that into a method of communicating with the general public that makes sense and is easier to digest and like can actually be actionable, and then puts it in front of those people. So it is basically a way to take the consensus of that specialty and like disseminate it to the public. So that's what this does. This is essentially, these organizations are speaking on behalf of the entire specialty. And so anything that goes through them is going to be validated to the best knowledge of the present day. And so of course that's going to change over time based on the data that comes out, but everything that they say is very heavily vetted and validated before it's put into these statements.
Right. So it's important to note, because I know some people have accused us of doing, and we talked about this before, but I want to reiterate it because it's important, that people have accused us of doing like an appeal to authority fallacy by talking about the statements that these organizations are releasing. But we're pointing to these statements because these statements represent the best evidence that we have. That's not to say that there might not come out a superior treatment method for trans youth in the future, or that the research couldn't be stronger in some effect. Of course, scientists, medical professionals are always going to advocate that the research gets stronger and we get more highly refined and accurate diagnostic methods and tools. But these are the statements that support the best medical evidence that exists today. So I wanted to read a few of these for you guys. We're only going to do about 3 of them. And I just think I didn't pick them because I think they were the strongest. I just randomly grabbed ones that I think were from organizations that would sound familiar to you guys. Because I think it's important. I keep saying that. This is really important. Trans kids' healthcare is on the line. It's important. So this one's from the American Academy of Child and Adolescent Psychiatry. And this statement was made in 2019. The AACAP supports the use of current evidence-based clinical care with minors. AACAP strongly opposes any efforts, legal, legislative, or otherwise, to block access to these recognized interventions. Blocking access to timely care has been shown to increase youth's risk for suicidal ideation and other negative mental health outcomes. Consistent with AACAP's policy against conversion therapy, AACAP recommends that youth and their families formulate an individualized treatment plan with their clinician that addresses the youth's unique mental health needs under the premise that all gender identities and expressions are not inherently pathological. Another one from the American Medical Association from 2021. Empirical evidence has demonstrated that trans and non-binary gender identities are normal variations of human identity and expression. For gender diverse individuals, standards of care and accepted medically necessary services that affirm gender or treat gender dysphoria may include mental health counseling, non-medical social transition, gender-affirming hormone therapy, and or gender-affirming surgeries. Clinical guidelines established by professional medical organizations for the care of minors promote these supportive interventions based on the current evidence and that enable young people to explore and live the gender that they choose. Every major medical association in the United States recognizes the medical necessity of transition-related care for improving the physical and mental health of transgender people. The American Medical Association from 2021. Then the last one I have is from the American Academy of Pediatrics, and this is from last year. There is strong consensus among the most prominent medical organizations worldwide that evidence-based gender-affirming care for transgender children and adolescents is medically necessary and appropriate. It can even be life-saving. The decision of whether and when to start gender-affirming treatment, which does not necessarily lead to hormone therapy or surgery, is personal and involves careful consideration by each patient and their family. So, as you can see, each of these organizations has pointed out that the evidence strongly suggests that gender affirming care is valid and that transgender identities, according to the evidence, are valid. This is not gender identity ideology. This is not something that some people on Twitter came up with. People on Twitter get crazy. I'm right there with you. People on Twitter say some wacky shit sometimes. These are the statements supported by the best available evidence of all the major medical organizations that we in America and around the world depend on for our medical care. They're the physicians who are probably leading most of the research and development that we're seeing in not just transgender care. I mean, Matt got a diabetic sensor a couple months ago. Mm-hmm. That is the new version where it constantly tracks his glucose levels. He doesn't have to, there's no more pricking the finger. There's no more scanning it every couple times a day. The amazing doctors within these organizations have discovered a new way to keep track of this stuff throughout the entire day. The healthcare unrelated to trans people that we all depend on comes from these doctors, and we trust it on those other topics when it comes from these doctors. But for some reason, when it comes to trans healthcare, we don't trust the doctors. And I want any of you out there who are saying, that's me, I'm not so sure we can trust these doctors on this, to ask yourself why.
Call in, I dare you.
Yeah, call in, we're happy to talk to you. But I want you to ask yourself why. Because if you are willing to accept what your doctor says is the best course of treatment for your kid who has diabetes or cancer or depression or schizophrenia or any other condition, anything else that could affect your child. And I'm not saying that being trans, a trans identity, is a pathology. What I'm saying is that the treatments that are recommended by doctors are never fought on this level from any of these people on any other condition, but they are fought on trans healthcare. And the only reason that I think makes any sense is that people have a prejudice against trans people. And for some reason, they don't believe in the evidence from the same people who they trusted from in every other situation on this instance. And it's pretty terrifying to think that doctors could be incriminated and imprisoned, fined, lose their career. Families are being forced to upend their communities, uproot themselves out of the communities that they have been living in to move away to a state where they're not going to be persecuted for receiving evidence-based care from their doctors.
And this is going to negatively affect those states too that are passing these laws, because like we already have a physician shortage. And now if you're going to incriminate doctors for providing gender affirming care and then they decide to move, you're leaving your state in an even worse position for a lack of physicians. Like you're going to drive your physicians out of your state and they're going to go somewhere else, but also the patients are going to go somewhere else in an already incredibly overburdened system where now people's access in general is going to go down. So it's causing problems on a lot of levels. And we could, I mean, granted, we're not going to fix the healthcare system overnight, but like we could at least like keep physicians in those states by not incriminating them for doing evidence-based medicine that they've been trained to perform.
Right. I mean, I already am seeing a lot of pushback in the chat of things like Z8 saying there is long-term studies and research on things done like diabetes, not on the trans thing. Do you have males? Do you have males taking female hormones? That doesn't make sense. So I already don't trust your thinking because you can hardly spell.
They should call in. I'll debate that.
Yeah, and vice versa when their bodies are not designed to handle it. I'd like you to make the argument that our bodies are designed to handle anything, first of all. And secondly, I think you've missed the several statements I made from things like the American Medical Association talking about how empirical evidence has demonstrated that trans and non-binary identities are normal variations of human identity and that this care is evidence-based.
For people who...
Sorry, go ahead.
Well, like for people who want to say that humans are designed at all, like I want to give you like just one example of just how great the human body is. Like I know Arden has studied the brain a good bit as well, but like imagine you have probably the most important organ in your body, and you're gonna try to protect it within like this armor shell of a skull, but we're not gonna anchor it to anything. We're just going to let it like free float in some fluid inside this shell, but then also we're going to put spikes inside the shell so that when your brain moves around in the fluid, it like runs into the spikes and then you get concussions. Like we're designed for some pretty great things, like our most important organ to be harmed by our own protective mechanism. Cool. Yeah.
Yeah, I just, it's a little bit frustrating because I'm happy to talk about improving the standards of care, improving diagnostic criteria, improving the research. But
absolutely.
Not a single caller who's ever called into the show has presented a reason why these organizations are not trustworthy on these particular statements. Nobody has ever presented evidence that a superior alternative method exists. Because let's remember, medicine is not about picking the best objective method. It's about following the best evidence we currently have, even if that evidence would not be sufficient in other situations. Nobody's calling in to present an alternative method, to overturn the evidence that exists, or to counter these statements in any way. All people have is, it bothers me when, it makes me uncomfortable that, well, I don't trust these doctors. Why should I care what you think? Present me with evidence about why I should care what you think. Because I can point to why my positions are the way they are. I can point to these organizations that have informed me in some capacity or another. I can point to the studies that have informed me in some capacity or another. I'm not interested in listening to callers today who are here to just tell me how they feel about something. You need to present me with evidence that backs up your point, or you are going to be ripped into, because that's the kind of mood I'm in right now. So I want you all to buckle the fuck up.
Yep.
Yeah. This is dangerous for trans lives. Mm-hmm. I care about the truth, and I care about trans people, and I want to follow the evidence for the best way to treat trans people. And right now, that's supporting gender-affirming care for minors, age-appropriate interventions, guided by their doctor and their parents in agreement. And unless you have something better to bring, I really don't care about your suspicions or your feelings. Mm-hmm. Bring me evidence. And with that, we do have full lines.
And we've got a call that's kind of spicy and along the lines of what we were just talking about. So
yeah, you're talking about 6'5".
Yep.
Yeah. Okay. All right. So we're gonna bring in. Let me hold on. I'm producing and hosting today, so I've got to multitask here. We're gonna bring in Olivia in Texas. Pronouns are she/her. Is a trans woman who is against child transition. So Olivia.
That's an inflammatory statement, and I'm not exactly. I'm very nuanced.
Okay. Well, let's get into the nuance.
Yeah.
Then. Make your case. What issues you have with gender affirming care, and specifically why. And I want you to cite like actual evidence, not just it makes you uncomfortable or you think kids are a certain way or aren't a certain way. I want you to actually bring evidence.
And bear in mind too, you are debating a doctor here. And
yeah, I want to talk to you.
I know a little bit about kind of what we do. So yeah.
May I ask a question, Dr. Ben?
Yes.
Can I just ask a simple question because I don't know this answer, and it affects my opinion a lot.
Okay. Yeah.
Can genitals and orgasms develop on cross-sex hormones after you block the original state of development? Meaning, can a young trans girl who never had testosterone have an orgasm as an adult on estrogen only?
This is kind of a nonsensical question because, like, are
it's
you
an important
addressing?
Question.
So I'm going to address it. I'm going to address it, but it sounds very nonsensical to me because the erectile tissue in males and females is the same erectile tissue. Right. It's like, a clitoris and a penis they're homologous structures. They erect in the same way. It's just one has kind of more tissue and one has less tissue, but they're basically the same structure. And so if we're talking about a person who Let me clarify this, make sure I'm getting this right. You're saying that somebody went on puberty blockers and then went directly to cross-sex hormone therapy and didn't go through their endogenous puberty, then that's the situation you're talking about, yes?
Yes.
Okay, yeah. So the tissue itself, like, you would still be able to undergo that, is my understanding, because the structure is the same. Like, it's not gonna be it'd be very weird to categorize that in like a binary sense of like they're not getting a quote male orgasm in the way that they would if they had undergone.
No, a female orgasm. She's a woman. Can't
Yeah,
you
well,
have,
I'm saying physiologically, like
that
it
feeling,
would still
that
be an
that
orgasm.
feeling?
It would still be an orgasm, but it's like it's weird to define it with the binary, which I'm saying like you couldn't really do that with this case, but it would be very similar. Yes,
I understand.
it would be an
Thank
orgasm.
you for the answer.
Yeah,
But that was just a point of information, and it's not why I believe what I believe. Why I believe what I believe is that I have, in my life, as a trans woman, met so many kids who were, like, beaten and abused and saying, stop being a boy or stop being a girl. And it's really a violent and humiliating situation. And so and I've mentioned this to Arden one time before, you can't stop being something you're not, and so you take on that identity, right? And so now we have a new bill up before Congress saying that professionals for profit can't explore that. But that's not where the conversion happens. It happens in churches and nonprofits. And so I'm saying that these organizations that are nonprofit are abusing children in horrid ways, and then they go to a professional, like, I'm messed up, I want to kill myself, and then they must affirm this cross-gender or cross-sex identity. This sounds like conversion therapy to me, but there's more than that. Can they have orgasms?
Olivia, what did I tell you at the beginning of this call? What did I say right when we started the call?
Yeah. Evidence. I can say my own process, and I
don't care about your own process. I don't care about your own process.
I can list 10 kids who
actually,
have this.
I'm going to mute you. Olivia?
That's an anecdote. That's not evidence, what we're asking for.
I told you, you're muted, just so you know. I muted you on the soundboard, so there's no way you're coming through. When I said bring evidence, and you tell me that sounds like conversion therapy to me, Olivia, I don't give a fuck what sounds like conversion therapy to you. I'm going to unmute you in a second, and I'm going to tell you, if you don't make the case, I believe X because Y in that format and actually provide evidence, you're gone. You're done. You're unmuted. Go for it.
I believe that if you punish a child for having an identity that is not naturally theirs and saying, stop being that they will assume that identity because you can't.
Cool. Do you have evidence?
That's not the case, though. That's really not demonstrated by evidence.
Yeah. Do you have any evidence for that claim?
We don't do any scientific study at all. There is no evidence. Is the problem?
Okay. Cool.
Then your claim is kind of meaningless.
Yes, exactly.
There is evidence.
There is evidence. There is evidence supporting gender affirming care for minors. So I don't really care how you feel about a topic for which you have no evidence. So if that's all you have, it's been real nice, Olivia. You can go the fuck away and take your shitty opinions to someone who cares.
We should stop mutilating and convert.
Shut the fuck up. You're gone.
Okay, now you're just going to drop dog whistles. Yeah.
You are not a serious person. You don't have any evidence for your claims. You don't have anything to back up your point. All you have are hunches and suspicions. So, goodbye. All right, who else do we got? Is anyone else on that line? Current data on trans athletes in sports can be interesting. How about what are the effects of trans healthcare on fertility and libido? I don't know necessarily about libido.
It depends on what they mean.
All right.
It depends.
Let's bring in Friedrich in the UK. Friedrich, you are on the line. What's going on?
Hello, yes. I mean, here in the UK, it's like 11:30 at night, so you know. um, but yeah. Hi guys. I really love your show. I really like listening to you all. Um, so my question is, so I've been looking around quite a bit on trying to understand if it has any effects at all, the effects of cross-sex hormones or sex reassignment surgery, what effect that has on someone's fertility level, fertility level, and their libido or their sex drive. Like, does estrogen for a trans woman or testosterone for a trans man, have any effect on their sex drive and their ability to produce children of their own?
So this is a fun point of education that I love to bring up. So especially for trans men and trans masculine people, testosterone is not a contraceptive, and you can get pregnant on testosterone, and a lot of people do, and we need to make sure that we're educating people on that because a lot of trans men need to also be on contraception if you are having sex with a partner that can get you pregnant. That being said, there are some people that may experience some reduction in fertility just based on their own bodies, and that might be related to their own medical history. It's not in everybody goes through that kind of thing, but there have been some cases where some people have reported that. As far as libido goes, that's much more subjective of a thing, and you can get people ranging all over the board with this. I know with my own personal experience, my sex drive increased pretty significantly. And the way I experienced that sex drive is different. But with something so subjective, it's not something I can say that for sure this is going to change how you have a sex drive or how you engage in certain activities, because it is kind of all over the place with what I hear. I'll let Arden kind of talk about the trans women side of the coin.
Okay.
Yeah, I mean, I think Ben's right that in terms of libido, that's pretty subjective. I've heard a lot of different things. I mean, I think for some people, they do feel like a drop in libido, but a lot of things can help that. Sometimes that's a psychological thing. Sometimes they actually have lowered their T too much, and they actually need T more at the levels of cis women, which is like slightly over nothing. And once they get those more balanced levels, they feel better. Some people, it's not until they get genital surgery that they actually feel like they're really able to interact with their libido. In terms of fertility issues, I pulled up a study just barely that seems to suggest that overwhelmingly transgender youth, when they are entering any form of pubertal suppression or cross-sex hormones, they are given options for fertility preservation. That's pretty much standard practice, is to offer that for someone. So I'm pretty sure, sorry, I also zoned out because I'm doing production things and I was looking up that study while Ben was talking. My understanding is that, at least when it comes to puberty blockers, if it doesn't go longer than 2 years, which is what the medical guidelines would indicate, and after 6 months following cessation of treatment, there doesn't seem to be any long-term damage to fertility. But that's given that you actually follow the medical guidelines and don't take the puberty blockers for longer than 2 years. If there are edge cases where somebody's doctor didn't follow those guidelines, I could see that being different. I think there is fertility loss, at least for trans women, when you take estrogen. But I'm sorry, if I'm already reiterating stuff Ben has said, feel free to tell me to shut up.
Oh yeah, no, I didn't go into that side of it because I wanted to let you speak on that. So
sure. Yeah, those.
Okay.
Those are kind of my thoughts on fertility and libido. So is that what you were thinking, or did you have another kind of direction you wanted it, or what's up?
No, I think that was that was a very insightful kind of rundown. I just wanted to get your general perspectives on this topic because because finding stuff online because trying to find something clear or comprehensive online, you find a lot of conflicting information, and then you don't know what to believe. I just thought I'd call in here,
Yeah,
to get your takes
I don't have
on
a
that. But yeah.
specific recommendation. I would say there. I'm sure if anyone in the chat has a specific recommendation of what I'm about to say, please post it or post what it is.
Mm-hmm.
I would look into YouTube. I'm sure there are videos on how to dissect an academic study, like a peer-reviewed paper. I would not Google it because you're gonna get like articles that are written by journalists who have no specialized training. I would recommend actually
Yeah.
look at the data and try to determine how to. There are methods to determine like the validity of a study, right? Like one study that gets cited all the time is the study that says like 88% of people desist. The reason most trans people and activists discredit this study is because the way they operationally define what a gender diverse youth is in the study is anyone who plays with like if a boy plays with a Barbie doll, he's trans for the purpose of that study. So when they say
I think
98% of people desist, like it's like of course because that kid was never fucking trans. I would recommend
yeah.
looking into how to determine the reliability and the validity of a study, and then going to like Google Scholar and looking through that.
Okay.
On Reddit, if you type in a comprehensive defense of trans people, musicotic, not every study is great, but most of them are. There's a huge compilation of a bunch of really good studies there. And unfortunately, I haven't had access to a medical journal since a few new really strong papers came out. But there is more research being put out on this like every year. So I definitely would, be careful about Googling it. If you know how to use Google Scholar and make those evaluations, that's probably a better place to go.
Oh, okay. So would that be the best place to look up further reading material on this subject?
Yeah, it's a little dense. It's kind of hard to get through every detail of a study, but like the important things are like how they sampled their participants and like how they're defining terms and like what kind of conclusions they're drawing from the data, because sometimes researchers like to jump to conclusions that maybe aren't justified, but the data is still valuable in some way. So I think if you know how to read a paper, that's probably the best source. But also, like, if you're not reading papers for other things, I think it's totally okay to accept what the medical organizations are saying. I'm not a specialist in
Yeah,
cancer
sure.
research. I don't read research on cancer to know how valid it is. I say, well, the American Cancer Association says this, and they probably know a lot more than I do. So why would I waste my time reading papers when people have read those papers and have released an assessment? Like, it's okay to rely on the consensus of a medical field for these kinds of things. You don't have to read every paper or read every article. We're not all medical specialists, and the way that this whole trans debate has made us all think we have to be medical specialists is silly, and it doesn't need to happen. So
and the way that even doctors debate these issues is like it's a lot more in depth than the debate we're seeing on the internet. Like, yeah, I'm not an expert in endocrinology or other things, but like I know how to have a discussion with people who are experts, and like I know how to evaluate certain guidelines, and I know when to defer to experts and when I can handle things on my own, and like how do we engage with each other and have these debates over guidelines. And that's something you kind of get within like medical experience and medical training, that like I would be comfortable having that debate with an expert that I think most of the public is way over their heads and trying to have that. Even if it seems like it's something you understand, like I promise the idea of not knowing what you don't know is very powerful to remember. And that's something like even like experts all have those moments. We all have things like that. Like the biggest thing I'm learning in residency, especially, is that I don't know what I don't know. And there's a lot more that I don't know than I know. And if the general public can understand that as well, like we would make probably a lot of progress. So.
Yeah. Okay. Yeah. Sure. Yeah. Thank you very much. Yeah. I guess I 100% agree with you there about about why it's important to trust the experts who specialize in these fields. So, no, yeah, good. I think that's thanks very much. I think that was all I would like to ask about today. So,
Awesome.
So thanks very much.
Thank you, Friedrich. I appreciate it. Have a nice day.
Okay.
Oh, I hit drop too early. I'm sorry. I thought the call was ending. I hit drop. All right. We've got lines full of interesting callers. So let's take let's take 4-3. He's been on the line since before the show started. This is gonna be a quick call.
Yeah.
Not gonna waste too much time on this, but Benjamin in Texas. Oh, can you turn off that music or whatever's in the background? And then go ahead with your topic.
Oh, shoot. I'm on? All right.
You're on.
Yeah, you're on.
Hi, yes. How are y'all two doing?
Doing all right. What's up?
All right. So, as somebody who's been an acquainted ally for several years behind my, let's just say, Republican parents, how do we respond to egregious claims like transgenderism somehow being a mental illness?
Yeah, so I mean, I would just appeal to. Yeah, go ahead. Do yours.
I've got my soapbox on this, but I know you also kind of maybe have a soapbox on this. I don't know. Do you want me to go on mine first, or?
Yeah, go for it. Go for it. Do it.
Okay, so like I like to talk about specifically. A lot of times when people say that it's a mental illness, they're comparing it to things like body dysmorphia, or they're comparing it to a delusion. And there's some distinct differences in why we don't call it a mental illness because of how it presents and the factors that will alleviate the issue. So when we talk about a mental illness, there are kind of two criteria that are going to label it an illness, and that's distress and dysfunction. And you need to have kind of a combination of the two in order for it to really be labeled a mental illness. So there are some things in life that are distressing but not dysfunctional, and that would be ill. Like if you have a lot of stress in your life about a new job or something, and like you're not dealing with difficulty in your everyday life, but something stressful to you, that might be distress, but it's not dysfunction. So you wouldn't be mentally ill, and you wouldn't be able to call that an adjustment disorder or something because you're still able to go about your life as you normally would. You just have some extra stress on top of it. Whereas there are certain things that would be kind of deemed as dysfunction, but not necessarily distressing. And this is something oftentimes when we think of like neurodivergence, might be something that like it's not a you problem. This is a societal problem to where society is not built for you. And so you might have some dysfunction in integrating yourself with a society that's not built for you, but you don't have distress because there's nothing actually wrong with you. You don't feel distressed about that, except for the part that, you know, society has had that contribution. So you kind of need both of those things. And with something like body dysmorphia, you have both the distress piece and the dysfunction piece. And the sources come from the brain. So it's a perception of your body that is flawed. So where even if you're not overweight, you might see yourself as overweight in the mirror, or might see yourself as really scrawny when you actually might have decent muscle mass. Like you might see certain features of yourself as being like unattractive when actually what you're seeing of yourself is not reality. And so that's distress and dysfunction caused by your brain. And we've seen with those people that when we try to correct the external factors, so if we have somebody who's very upset with their appearance, and then we fix their appearance to the way that they wanted it, the distress and dysfunction don't go away. They persist. Like often there'll be something else with their body that becomes the new focus of that flawed perception. And so they're going to keep having this distress and dysfunction even despite treatment. Whereas what we see with gender dysphoria, the stressor is outside of the body and outside of the brain. So it's like, it is a primarily like societal thing, to where your brain does not see an inaccurate picture of yourself. Like trans people, for the most part, know what their bodies are. We know what our hormones are. Like we know, we have an accurate perception of what reality is. But it just, we're not happy with it, but it's not to the point where we are dysfunctional. We have that distress, but can still kind of go about our lives. But then once we correct the external factors, such as society and such as certain anatomical features, the distress and dysfunction go away, right? So it's like, it's not something that is equatable. And so that's why we can't really say that trans is a mental illness. And so that's where, like, there are studies that focus on that specific comparison. And so I think especially when we talk about this issue of like mental illness, it's people that don't really have a clear definition of what a mental illness is. And especially when we talk about anything clinical, there are distinct medical definitions that we go off of. And like it often ends up being an equivocation fallacy where people will take a colloquial term and use that definition, but then try to use that definition in a way to prove a medical point. And that's problematic. Like you'll see a lot of people that will call a lot of things a mental illness when they aren't actually. And that's kind of what we're seeing here. So Arden, I don't know if you have a soapbox on this.
No, I think you thoroughly knocked that one out of the park. The only thing I was going to add is just, again, appealing to medical consensus, to your parents. Oh, I didn't realize you had a medical degree and your opinion, you had evidence that supports your opinion that outweighs the American Medical Association. Please do inform me of your wisdom. Because most of the time, people have nothing other than, like Olivia at the beginning of the call, I don't like when it makes me feel this way sort of answers. Which, you know, it's fine for you to feel that way. It's fine for you to not understand. It's when you start advocating that people be denied medical care because of it that it's a problem. Is that helpful, Benjamin?
Yeah, because they keep because they don't understand it. It's definitely what's the fallacy? Argument from personal incredulity, you could say right here, and they also attribute it to things like, say, homosexuality and stuff like that, and then they want to falsely attribute that to pedophilia, which it's just backwards thinking. I'm seeing from misinformation they've heard from online and such.
I mean, this is misinformation from like the 70s, right? The 60s even. Mm-hmm. It's like when it comes to like adult males who, sorry, trigger warning for a sensitive topic or whatever. We learned when I was getting my degree in psych, we talked about the reasons people assault and what it's tied to, right? And it's like when a priest assaults a little boy, it's not because he's like, man, I love men and I just want a small one. It's because he has power over that individual. It's not a sexuality thing. Someone who would be straight in their normal life is fully capable of assaulting someone of the same sex as them that's young. These notions are just not supported by the evidence at all. So, yeah, I mean, the best you can do is, it's also worth asking, you know, is it worth having these arguments? Is it something you want to do as a matter of, like, you know, maintaining your relationship with your parents and things like that? Those are all things that can go into this consideration. But I think it's good to challenge your parents. I don't think anyone should feel like they have to have arguments with their parents all the time. It's a difficult thing to do. Mm-hmm. So, yeah, I mean, hopefully that's somewhat helpful. It's not going to be foolproof. I mean, if your parents are already kind of digging their heels in on things like homosexuality being rooted in pedophilia, then you might be fighting an uphill battle from the get-go. I'm
just trying to help them by giving them the correct information and such, and I'm just tired of being lied to from whatever subject matter it is. I'm trying to help people at the very least, because that's what a loving son would do, right?
I appreciate that sentiment. Yeah, I mean, I think it's good to, you know, want to impart your parents with correct information if they're, misled or something. So if you want to try those out, you could call us back and be like, wow, that one thing you said absolutely did not fucking work, but this other thing did, I'd be interested to hear that. So,
All right. All right. Well, I love just, learning and knowing better and such
sure.
and such. So I thank y'all so much, and y'all have a great day.
Yeah, thanks. You too, Benjamin. Talk to you later.
You too. All right.
Oh, man, I did it again. Sorry. I'm a little spicy today. I'm a little heated, so I'm hitting buttons
Spicy.
fast. All right. We are going to take a caller in a second who I've been seeing in the chat who's been annoying the living shit out of me. But,
I know who you're talking
it
about.
might be a productive call. The stated topic is potentially a point of understanding and agreement. So we're going to try it. We're going to bring in Doug, Pine Creek. Doug, you are live on the line. What do you got for us? Hello. Man, are you there? Did you hit?
Can you hear me?
Now we can hear you.
Oh, sorry, I had my mic muted. Amateur rookie mistake.
No worries.
But first of all, I honestly don't want to cause any trouble here. I'm getting the impression that I'm being viewed as a troublemaker, and I don't want that. I mean, for me, there's only two real issues to talk about, and that is the sports thing, but that's been done to death. It's the transitioning of minors, and I think we're all agreed that that's probably the most important issue. So I was wondering if we could find points of agreement that, number one, it is a very serious, important issue. Are we all agreed on that?
Absolutely.
I agree with that. Yep.
Yeah, and so I think no matter what side you're on, we can agree that we should try to avoid mistakes and be very cautious. Are we agreed with that?
Yeah, I think these are softballs. Hit us with what's really going on.
Yeah. I think it depends on as well as your definition of caution and where we're going with that.
Okay. So now, this is a legitimate question. I don't know the answer to this, but what is the process for, let's say, a 14, 15-year-old wants to transition surgically? What does that process look like? How do they decide?
So it's very, very rare to get surgery at that age. So first of all,
I agree,
especially genital surgery is not done under age 18. So that's completely off the table until they reach an age of consent. Are you specifically only wanting to talk about the surgical transition, or do you want to discuss like the whole process of like if someone comes out and then I'm totally for
the, what do you call it, the counseling and that sort of thing. I think for most people in the United States, it's surgery and to a lesser degree, the hormones.
Well, no, actually, no. Surgery is not the primary thing that's done. So let me talk to you a little bit about the timeline of like if someone is to come out as trans. So there's kind of a stepwise process, and it's especially for minors is done very carefully. So the first thing that's going to happen is social transition and therapy. So basically, like we're trying very hard to do the minimal amount needed for people to relieve their symptoms, right? So especially in young people who don't necessarily meet the age of consent, I agree that we want to be cautious, but we don't jump straight to surgery. And in fact, a lot of people don't get surgery. A lot of people don't want surgery. And most people do not get surgery until they are at an age of consent, which is over 18. So what's going to happen is a person's going to come out, possibly to their family, to their friends as trans. And if they decide that they want to undergo transition, the first step is social transition. So we're talking things like changing your hair, changing a name that you want to go by, changing your pronouns, like changing the way that you dress, things like that are all reversible, right? Because even if you change your name, you can change your name back. Like, that's not an issue. So let's say we have somebody that starts socially transitioning and they really enjoy how they feel on that. And we get them in to see a therapist and they're talking about who they are. They're learning about things in their lives, like what they like, what they don't like about themselves. And like, they can tease out a lot of other things going on too. So they got somebody to talk to. They got somebody to process all this with in an evidence-based manner. And then it usually takes like the steps to go to a medical transition. Like, there's a lot of barriers needed to even begin that stage. So especially for minors, you still need to have pretty convincing documentation that says, yes, your symptoms are bad enough to where you need medical intervention. So the informed consent model does not exist for children. And when we're talking about medical transition for minors, we are talking very high risk children. So this is different than like a lot of people are saying that you can just say, I feel like I want to transition today, and then be whisked off for hormones, puberty blockers, and surgery. That's not what's going to happen. These are our kids whose gender dysphoria is so severe that we are talking about kids in front of you that it's like, if they do not get this intervention for medical therapy, we are looking at pretty significant psychological distress and like risk of self-harm and suicidality and things. So we're not talking about low risk kids, because they can wait a lot of the time and they will go through a lot of barriers. Like if someone just says, I feel like I want to transition, they have even more barriers to go through, because they have to clearly document that this is what is going to be the best course of action for them. But most of this comes down to, like, you have a kid sitting in front of you who's maybe ages 14, 15, who has significant risk of self-harm. Like, they've probably been hospitalized more than once. Like, most of the trans kids that I've seen have been hospitalized more than once for psychological conditions and related to their gender dysphoria. Oftentimes it's people who have been bullied incessantly and don't have a safe place to go, to where their suicidality is a direct result of people's actions upon them for being trans. Like, it's not other things. It's not them having delusions of who they think they are that they aren't. It is they don't have a safe place to go, and they would rather not be alive than have to deal with that. And that's the risk level we're dealing with here. So if you had a kid sitting in front of you that said, like, this is who I am, I'm happy with who I am, these other people are causing me so much distress that I would rather not be alive, and having this intervention would help me exist in this society where I could be alive. That's what we're dealing with.
Yeah, the only things I really have to add to that are, I did a quick Google search for studies on the like average age that gender affirming surgeries are done on in patients in the U.S. And granted, I did not have the time to like evaluate the study in its entirety, but the one number that one study gave was the average age is 29. And I think that makes sense when you just think about, for one, insurance is not going to cover most gender affirming care, and gender affirming care is incredibly expensive. So on top of the barriers that minors would have to go through to access a lot of these procedures, you have to consider the financial cost. I mean, unless they have parents who are very wealthy and willing to spend it on that, the kid is probably shit out of luck. But on top of that, when we're looking at the procedures that like kids are looking for, like, those are also relatively low risk that most of the young people are looking for. We're talking about top surgery and things like that, getting a mastectomy or breast implants, where the regret rates that we see are extraordinarily low. So I'm failing to see a really valid reason to stop minors from accessing the age-appropriate medical interventions that, as Ben pointed out, their doctors have agreed upon. I mean, for example, like, even as an adult, when I got face surgery, I had to have 2 letters from 2 different therapists saying that they approve of me getting the surgery and that is for gender dysphoria and that I have a documented history of gender dysphoria. Whereas a cis woman who wanted all of the exact same procedures could go to that exact same doctor and get those exact same procedures without any need for medical documentation proving their case. And even though I paid out of pocket, I still had to prove to the doctor that I was actually trans as an adult. Like, these are hoops that I had to jump through. I had to do lots of work that I didn't love doing in order to pay for the surgery that I got. There are extraordinary barriers in front of children, and like the notion that the majority treatment that kids are getting in the US today is surgery is just detached from reality.
Okay. Yeah, everything you said was very reasonable, especially I understand and realize that it's a very small percentage, but I just want to be clear. Are you both for, in the very rare cases, let's say bottom surgery for minors?
No, bottom surgery for minors does not happen. So take away that argument.
I'm asking if it did happen, would you be for it or against it?
If the evidence suggested like as Ben is saying, this is not the world we live in today, but if the evidence suggested that genital surgery at a certain age was developmentally appropriate and led to the best outcomes for those kids, then yes, I would support evidence-based medical care for children, like I do for every other medical thing that a child might face.
And do we have that evidence?
Currently, we don't
today?
have that evidence. So currently, okay. I'm currently not in support of that because we don't currently have the evidence. But like Arden is saying, if the evidence came out and was statistically significant that showed that there was a like certain number needed to treat and all that stuff, the metrics that we look at were in line to say that this is an appropriate guideline, then yeah, I would be. But we're not there. So I think like maybe even presenting that argument is a bit disingenuous because that's I wonder if you're trying to get us to agree with something that isn't currently like the situation and that we don't have the evidence for.
But I mean, this is really easy. I've said this so many times.
Yeah.
I support evidence-based medical care. Transition care for minors, as it currently stands, the developmentally appropriate stages, is evidence-based. Could the evidence be stronger? Of course. We always want stronger evidence. That's just the nature of science and research. We always want to progress our evidence, progress our diagnostic criteria, progress the treatments that we give people. I support evidence-based medicine. What we're doing for minors right now, or what we were doing before a few states started attacking this care, was evidence-based care. I support that. If it came out that genital surgery for 14-year-olds was the best outcome for them, I would support that because that's evidence-based medical care.
Okay, so what I'm hearing from you both is that there is no evidence currently that bottom surgery works for minors.
Yeah, so
we
I think
don't have that phrasing is problematic because it's not about whether the surgery works or not. It is whether this surgery is evidence-based to where we can establish a general guideline. And so that's the issue here. And like how we establish guidelines is a bit of a nuanced topic, but like we need to have basically a cost benefit analysis and say like for certain cases, this is the expected benefit. These are the expected risks. Is it worth the risks to provide this benefit? And is that consistent enough across the board for this population to where we can say this is a general guideline and most people in this circumstance are going to have a similar result? And that's what we're talking about. So it's not really a matter of does it work or would it work? Or that's irrelevant. Is can we make this a guideline?
Right. Okay. So what I'm hearing is you both agree that we don't have the evidence to say that the benefits outweigh the costs for bottom surgery for minors.
Yeah.
For a general guideline.
For genital surgery.
For a general guideline.
But that is not to say that gender affirming hormone care, that getting potentially top surgery for people 16 and up isn't acceptable. That's not to say that all of the other age-appropriate medical interventions that are established in the guidelines are not supported, because they are. They're very well supported.
But it sounds like on the very serious issues, we're agreed.
Yeah. So I don't. So what are you calling in for then? I saw you in the chat kind of like pushing back on some of the things people were saying?
No,
Or, like,
I didn't push
asking
back at all. I asked
questions?
questions.
Okay, so I heard you be like, I'm getting banned for asking questions. I trust our mods. Our mods are pretty fucking good. So like, I have a hard time believing you were just asking innocent questions that didn't sound loaded or problematic. Like I'm getting the sense that there is more underneath this that you're not getting to that I would rather get to. Well, I appreciate what you're doing. Let's establish the points we agree on and make sure we like care about each other or something. It's very street epistemology of you. But let's like actually get to the meat of what's going on here.
Well, no, I am dead serious with you. My biggest concern is exactly what we're talking about, and it seems we're agreed on it. My second concern is, I guess, with the sports issue. Like you tell me if you agree or not, or where what we could talk about if you want more drama. But I think that if you were born with the ability to produce sperm, you should be in men's sports, and if you weren't, you should be in women's sports.
Why?
And
Why does
what does sperm have to do with sports?
I would like to know what the gametes you were able to produce at birth has to do with your athletic performance. Please make that connection.
I'm just defining what a man is, I guess, and so I would say that men are far, far superior than women in sports.
Okay, so
what does that
I have a
with
little
your
bit of a problem
production?
with your definition of man because
okay, forget I said that then.
So here, let me tell you what my position is on sports, and it's informed by what the IOC is doing. I think that
I actually know your position on sports because I just listened to it a few minutes ago from last week's show.
Okay, cool. So, do you want to reiterate it?
And where we disagree is
okay. Yeah, tell me where we disagree. That's fine.
Yeah, I think where we disagree is like a great metric for sports is track and field because it encompasses both running and strength and all that. And on average, a male is just extremely superior to a female. Can you find males?
Do you know what an average is?
I hate
Do you know what an average is, Doug? Can you tell me?
Yes.
What is an average?
An average is the sum of all the metrics divided by the total number.
Yeah.
So
median is the middle.
Are we having, when we have people, so when we compare an average, is that representative of the entire population versus, like if I were to pick people out and have them a man versus a woman in sports, are they going to be representative of that average? Is that average going to be played out in sports in general?
Depends what you're talking about, but on average, if you pull an individual
right, so you're already adding
a random
depends
sample,
there, so it's not consistently the case. And so, like, if I were to give somebody, which like I reject the whole concept that men by default are on average are better than women in sports because sports are it's a very nebulous and broad topic because like there's certain sports where women have a more of an advantage. Well, because there are certain sports where flexibility and agility are more important than strength and muscle mass. There are sports where muscle mass ends up being a hindrance. But
I agree.
Like let's say, for example, like if we take someone who was assigned female at birth, we take somebody who even was completely all of their biology aligned with being female, and we gave them like a crap ton of steroids like during puberty, do you think they would by default be inferior athletically to somebody assigned male?
By default,
if they went through a testosterone-based puberty. Why?
Yep. Because there's more than just
Why?
hormones that are... Yeah, because it's more than
like
just
what?
hormones.
Give me examples.
I'm not sure if there's a delay.
Give me examples. What causes
lung
what
capacity,
causes the physical superiority?
Muscle mass.
What was that? Muscle mass? What causes muscle mass?
No.
Lung capacity. What causes what causes your lung size to be what it is?
What causes the lung size to be what it is? Genetic.
How do you grow your lungs? What are things that grow your lungs throughout your life? Do young boys and young girls have different lung capacities because of their sex?
Yes.
Do they?
Do you have
a citation for that?
I haven't. I'm genuinely
no,
asking
not on
because
me.
Okay. Do you have you
Well,
encountered
hey,
one before?
Dr. Ben, let's find points of agreement, okay?
Okay,
Do
Doug,
you
No,
agree?
I don't care. I don't give a shit about your points of agreement.
Yes.
I am like, you're trying to avoid the fact that you're saying some things that are incorrect. So I want you to answer my questions because
Okay,
you've
what's your
made some
question?
claims that need to be backed up. So yeah, okay. So you made the claim. So let me repeat your argument back to you. So you said that if we had someone assigned female that went through a testosterone puberty, like even artificially went through a testosterone puberty, that they would be inherently inferior to a cis man who went through a testosterone puberty because of
No,
a
no, no.
specific example being lung capacity. And so if sex is the determining factor, not hormones, but other biological sex factors makes that different, then we would expect in childhood, right, to see boys having different lung capacity than girls, correct?
No, there was a bit of miscommunication there.
What's the difference then? Tell me the difference.
If you look at, let's say, 100-meter running times of an 8-year-old,
That's not
male
answering my
versus
question. Answer my question about lung capacity. Why is the lung capacity different in boys versus girls? What causes differences in that?
my answer I gave you
Because there's an
earlier was
answer here.
genetics.
There's an answer here, and I think you're avoiding the answer here because there's something in puberty that happens generally for males versus females that causes differences in size of certain organs. And I think
Okay,
you know
Dr.
what
Ben,
that
you're
is,
right.
and I think you're avoiding it. Right.
No, Dr.
What is
Ben,
that
you're
factor?
right.
Tell
You're
me.
right.
Tell me what
Hormones.
the factor is.
I'll give you what you want. Hormones.
Yes. Good job.
Okay, but
Can I
but
ask-
can we not
can
do
I
the
ask you a question
patronizing
now?
give you what you want thing? Can we just acknowledge that you made a statement that
Well-
was incorrect and Ben pointed out why it was incorrect and now you're admitting that you were incorrect?
I was wrong. I'm sorry.
Okay,
Thank you.
Can I ask a question now?
go for it.
Are you aware that 8-year-olds pre-puberty, males, boys, outperform girls on certain sports
What
like track and field?
Well,
okay,
can I-
so provide the statistic, but also like explain the factors that contribute to that
I
statement.
don't know.
If I could jump in here,
I don't know.
Yeah, go for it, Arden.
But I do know the data.
if I could jump
I do
in
know
here.
the times.
It may be the case, Doug, that young boys do outperform girls on certain measures, a certain percentage of the time. I wouldn't object to that. Just like I don't object to when we do assessments and we find out there are any differences between groups, but there are a number of factors that get involved, and you can't just assume because of correlation there's a causation there. You can't just assume just because someone's male that is what's causing them to outperform. There's a number of factors going on there, but I agree that the stats do seem to indicate that on a lot of sports, a lot of athletic measures, people who are assigned male do perform better on average than people who are assigned female. But that doesn't say anything about why trans women shouldn't compete in women's sports. You have actually not made
what
the
I'm
case for that at all, which is what you...
What I'm getting at with my question, like 8-year-olds, 7-year-olds, 9-year-olds, if it's true that, let's say, they run the 100-meter faster, throw the shot put further, pre-puberty.
Well, my
How
thought.
do we
So here,
explain that?
there's some factors in here that you're not considering though either, because think about society and how society raises boys to be athletic and raises girls not to be, and learning things like muscle memory, having earlier athletic activity, having more consistent athletic activity. Certain things like also are confounding variables here that you can't just say this is purely a sex-based difference. And if you are claiming that it is a sex-based difference, you need to provide evidence that that is the contributing factor, and you have to control for the other variables.
Yeah, and
So-
we can say if it's true, yada yada yada. I mean, if it's true that trans women were gifted the charm of weightlifting from Thor, then they probably are going to destroy in weightlifting competitions. But we actually have to make the case that that's true. Like, again, even if we make the case, for one, I know the studies that have evaluated transgender performance, specifically trans women before and after hormones, showed that trans women before hormones aren't even the same as cis men in athletic performance. So there's already a difference in those populations and a flaw in assuming that they're the same. But this whole conversation started from you saying you don't think trans women should be in women's sports. And
Right.
I I would like to understand why, and I don't really feel like you've made the case, because not all trans women are going to outperform women in women's sports just because we're assigned male at birth. If I don't understand what the objection is to a system that would fairly evaluate individual athletic performance and promote guidelines like the IOC, where wait. I don't understand what your objection is to things like the IOC's guidelines that use evidence that, testosterone in these certain levels in the blood, volumes in the blood, is what is contributing to athletic performance. And when that's reduced, we see a statistically significant difference in performance in certain domains of sport. And therefore, we can evaluate individual athletes and say, does this athlete have a competitive advantage? No. Then discriminating against them is nothing but discrimination on the basis of them being transgender. And it has nothing to do with fairness in sport or athletic performance, if that's the case. Whereas if you actually just follow those guidelines, you can fairly evaluate athleticism and let anyone compete, and it would be fair. What is the objection to a system that fairly evaluates individual athletes and doesn't discriminate against entire groups without justification?
It's the same as the objection you gave 1 week ago, that there is evidence that even after the hormones are taken away or added, that there's still seems...
If you're bringing up my own point, you don't understand my point. There is evidence that in some domains of sport, some trans women who've gone through male puberty might maintain an advantage. Might. But not all of them who go through male puberty do. And not all trans women go through male puberty. So banning the entire group, trans women, because of a small subset within that group, I don't know if you know set theory, but we're going to do a little lesson. Imagine a big circle, trans women. A smaller circle, trans women who have a competitive advantage in, let's say, running, for this example. Banning the entire circle because of the little circle is not discrimination because you want fairness in sport. It's discrimination on the basis of their identity over which they have no control. And that is, in my opinion, exclusionary, wrong. It separates people from something that's extremely important.
May I ask why you think it's wrong to discriminate that way?
There's actually specific citations from those groups that I listed at the top of the show that talks about how inclusion to sport is statistically correlated with improving in people's well-being, feeling connected to their community, reduction in all of the symptoms that trans people suffer with in our society, like suicidal ideation and depression. So being a part of sports is important for their identity and for their sense of community and belonging. And you want to take it from them because they're trans, not because there's a fair advantage. You say there's a fair advantage, it's because it's a fair advantage, but you haven't actually demonstrated that that is why you want to ban all trans women. So please try again, make the case for why you want to ban all trans women, because a small subset may have an advantage in specific situations.
Well, we're agreed in principle, at least partially. Where we disagree is
this is why I hate straight epistemology people. Listen, Doug. I want to have a productive conversation with you. I really do. And so far, I think you've been a mostly honest interlocutor on answering the questions. Talked. Yes, because you're saying incorrect things, and I'm not just going to let you walk around with that. So
you guys are talking like for minutes and minutes, and I can barely say anything.
It's our show.
If you stop saying incorrect things,
I know
I would
it's
let
your
you
show.
talk.
You can do what you want.
If you stop saying incorrect things, if you stop saying incorrect things,
talk.
if you stop saying incorrect things and trying to talk over me, I would let you talk. But instead,
I'm actually
you say
trying
things
to build a bridge here, and you guys are just so angry.
Listen.
You keep saying.
Wait. Please let me finish.
That you're okay.
I'm sorry. I know. I talk a lot, and I want to let you talk, Ben. I'm not trying to talk over you, but please, Doug, I appreciate you're trying to do this like street epistemology, like let's find where we connect and find like levels of disagreement and where we can progress forward, okay? But then you're advocating for a position that would ban all trans women, which statistically impacts their well-being. This is a known thing because some of them...
Can we talk about that?
Because, let me finish my point, please. Because some of them might have a statistic advantage. That doesn't make sense. You need to actually make the case for why all trans women should be banned, because you have failed to do so thus far.
Okay, I'll make a very simple argument.
I want to jump in with my point. The reason why we keep stopping you is because You've been smuggling in points under this veil of just asking questions and just having a conversation and trying to agree so that you look like the good guy and we look like we're bad for interrupting you and all this stuff when you're smuggling in points. Like, for example, like when we were talking about like genital surgery for minors and we said like we're going for guidelines and you had left out the fact that it was a guideline and you tried to frame it as this absolute thing and try to trap us in a particular statement. Like, we see what you're doing with your arguments.
Right, and then you're doing these condescending,
like,
fine, you're right, I'm wrong, you're so right.
We're not going to let you play that game. You actually have to prove your arguments and not play these games with us.
So, go ahead, make your case. Last chance, and then we're going to move on from this call.
Yeah, I don't think it's actually worth dialoguing.
Cool, bye. All right, Doug's gone. Here's the thing. We've had many productive conversations with people who disagree with us on this show. But Doug consistently says, I think all trans women have an advantage over women in sports. And we say, okay, what's your evidence for that? Well, my evidence for that is that cis men are always better than women at sports. And you say, okay, what's your evidence for that? And he goes, well, most of the time they are. Okay, so they're not always better. And therefore, even though trans women don't represent cis women, from your worldview, trans women also aren't always better. But you want to ban them all the time. Yes. Okay, make the case for that because that doesn't actually make any fucking sense. And then when we correctly challenge you on your incorrect points, you cry and you go, you guys aren't letting me talk. You aren't letting me be incorrect repeatedly on your show. Yes, because it's our fucking show. Because I actually care about the truth of what's affecting trans people. If you don't care about the truth, I don't give a fuck what you have to say, Doug. I don't care about looking like a bad guy to you. I don't care about you thinking I'm mean and not productive at dialogue. I'm not here to hold your fucking hand out of bigotry. I'm here to speak the truth about what trans people are and what is okay or not okay to do to us in the society. And I actually want the facts, which you have failed repeatedly to bring. So you can go cry to your own little audience, which is just full of the same shitty anti-trans atheists. I've heard lots about it, even when I was being asked to be on your channel by your producer or something like a year ago. So never gonna fucking happen, you annoying little troglodyte.
I would not be surprised if like part of this gets clipped out and only
Good.
the parts that make him look better.
Do it. Let him clip it. Let him go be a little whiny ass bitch to his fucking audience. I don't give a fuck what he does. Okay. We still have full lines and it is almost 6:30, which is usually at 90 minutes is when we stop taking calls. I would like to get through at least like half of these maybe because people have been waiting on the lines.
Yeah,
I am going to close all the new lines though, so we won't be taking any new calls after this point. Okay, let's see. Current data on trans athletes. With all respect, Daniel. Oh wait, you can't hear me. Let me turn on the... Okay, hi, people in the queue. You can hear me now. Daniel, with all due respect, we just answered this question in a lot of detail for the previous caller. So we're not going to take you today. I thank you for calling in, but you can either hang up or we're going to drop you later. Let's take Ivan, who wants to set things straight with me. Ivan, you are live on Transatlantic. Why don't you set it straight? Tell me what I did wrong.
Absolutely nothing. I did it wrong. So first of all, I wanted to profoundly apologize because I wanted to express something that's, well, a bit more complicated as I found it in a very short way, which sounded good in my head, but didn't get across well. So I do apologize for making you feel uncomfortable and anybody else who was maybe listening.
Yeah, I appreciate that. And I'm sorry if I misunderstood what you were trying to say.
Well, if you misunderstood it, it's because I miswrote it.
Maybe.
So,
I do pop off. There's no doubt I have a little spitfiery on people, but I appreciate your attempting to amend that. So yeah.
After the last call, I'm a bit scared, but that's fine.
I have that effect. Go ahead and tell me what's up.
So what I wanted to say, my message was, if I remember it, here to the girl who made this cis straight guy open a new door of sexuality or something like that, I guess.
Something like that.
Yeah, you took it in a way that I might be discovering something bi or gay, and that's like I understand where this leads, and it's absolutely not what I was. Even if that, like, I wouldn't be saying that because it would just be disrespectful. Anyway, what I wanted to say is, because I'm straight, it's anecdotal. It's not evidence, but because I'm straight, the fact that I like trans women attract me is evidence for me that we're talking about women, because I do have a lot of evidence that I am straight. I have been in a lot of situations where I could have acted with guys, I just didn't.
Mm-hmm. Yeah, I appreciate the clarification. And if your attraction to me, you think open your door to sexuality or whatever, I appreciate that. Whatever we do, it has helped you to feel like you are coming into a better understanding of yourself. Yeah, did you have? I just realized your question is on transports again, and we just made the other guy drop for that. But,
I said just if we have time, but that's irrelevant. Now, what I was wanting to ask, is it possible that sexual attraction actually has to do more with gender than with sex?
I think it almost certainly does, because when you're walking down the street and you see a girl and you're like, damn, she's hot as hell, you aren't looking at her chromosomes or her genitals most of the time. Maybe you are where you live, I don't fucking know. But most of the time when I see someone who's hot, I don't know their chromosomes or their genitals. I am seeing how they're presenting their gender, and that's what I am basing that attraction on. I think there are probably assumptions in there, but it's informed by gender, not sex.
Yeah, sure. Well, I do have one question that might end up spicy. So, do you think there should be some kind of way of letting people know what kind of genitals somebody might have? And let me clarify. Like, for example, there was a call, I think last time, of a girl who had a trans girlfriend, but she transitioned while they were together. And she's completely supportive, but she is going to, she wants to do bottom surgery, and she's going to basically miss a penis, and she's being supportive, she's going to stick with her, but she's going to miss it. So, if you're meeting someone and you might like them physically, but you just do not prefer penises or vaginas, is there a way that you could or should know what there is? Or should it be irrelevant? What do you think?
I've talked a lot. I want to let Ben have a word.
Well, I mean, I think that this issue, the problem is the idea that you should be able to look at somebody and know what's in their pants just based on what they look like. And I just think that that's kind of like the bias that people are going into this with. And I think that whole concept is garbage. Basically, you're not going to know necessarily what's in somebody's pants, and we all need to fucking get used to it because you just don't know. And that's okay. But if there is somebody that you want to have a sexual relationship with, then of course, you're going to want to be in a consensual relationship where you can do that. And in that case, it's appropriate to have the conversation with them and say, hey, these are my sexual interests. What are your sexual interests? And they can say, this is what I like and this is what I don't like. And just like you would with any cis person, how you'd say, hey, this is what I like to do in the bedroom. These are my boundaries. These are things I don't want to do. And then you can figure out, do I have chemistry with this person sexually? Is if you don't like to do any of the same things, maybe it's not a really good fit, but if some things are okay, yeah, I'd be fine doing that, maybe it's not my favorite thing, but I'm still okay with that, it's important to have those conversations anyway. And so I think that this can be part of that conversation, and you find out okay, yeah, I like what you're bringing to the table, do you like what I'm bringing to the table, all that, and if it works, cool, and if it doesn't, it doesn't, and then you move on and you find somebody else. It should just be part of we should just normalize that conversation to have with anybody.
Yeah, hard agree.
Okay, that makes sense. I mean, what you said that we shouldn't expect to know what somebody has in the pants by the way they look. It's a really good idea. I think we're a long way from that, but yeah,
I agree.
I mean that would be the goal.
I think there may be situations that like kink clubs, I know there used to be some like swingers clubs and stuff where you could wear certain color bands on like your wrist or your arm or your head or something that would indicate like I'm into this or I do this or this is like what my body is or whatever. And I think there are maybe some environments where a thing like that could exist. I think in just the general dating world, I think it's probably going to be kind of difficult to implement something like that. But I personally, and we've all advocated on the show that I think genital preferences can be fine if they're communicated in a respectful and not shitty, bigoted way. And you can be like Ben just said, like, here are the things that I'm into. And if all of a sudden that precludes somebody because they don't have the right parts for that, then it's an easy, like, you know, I can appreciate that you have that preference and I can't fulfill that for you. So it's probably better that we find other people or something. Like, there's definitely respectful ways that you can communicate something like that. And it's probably going to have to be the effective method for a while. Maybe society will get to a point where you can like tattoo your genitals on your forehead and then everyone's going to not be weird about that. But we're definitely not there yet.
Yeah. Okay, well, thank you. I have more questions, but let's leave that for some other time because you have a lot of calls. Thank you very, very much for having me.
Thank you, Ivan. Have a nice day.
Bye.
All right. Man, all of these calls actually sound interesting. I don't want to be careful. Let's take, I think number 10-5. I get the impression that this person wants to explain why people wouldn't transition as a trauma response to abuse, but maybe I'm wrong. Mm-hmm. Either way, I would like to hear what you have to say. Peyton in Canada, pronouns are they, them. You are live on the line. What's going on?
Hey, can you hear me?
Yep.
Cool beans. Yeah, so just to preface, I'm trans. Mm-hmm. I also have PTSD. And I'm also finishing my PhD to be a psychologist right now. So I also work with lots of queer and trans people. And some of them also have like trauma backgrounds.
Sure.
So I wanted to bring this up because, you know, someone was asking about trans as a mental illness, and I think her name was Olivia. The beginning was talking about if kids are abused and then they want to transition, and we know that trans people tend to have higher rates of, you know, adverse childhood experiences potentially on average. And you know, I think it's a very interesting topic, because I think that we tend to, if we were to, let's say, consider that for some people they do, part of the reason that they're transitioning is in response to negative things that have happened to them. I think it's a really interesting conversation to consider, like, why is that considered such a problem?
Oh, Peyton, you're amazing. Oh my God.
Yeah, I just want to give a personal example. I'm studying to be a psychologist because the things that I experienced growing up, being like in foster care and experiencing abuse, made me want to be a psychologist. Does that mean that my psychologist inclinations are a mental illness? You know what I mean?
Yeah.
And just like when trans people get, like, for example, I've had a client who had top surgery. They're trans, because they wanted to feel free to be topless, right? And many people would say, well, you know, that's a societal problem, right? Because people with breasts should be able to just be topless. Well, yeah. And also, so what? When they had that surgery, it made them feel really good. And we're only on this planet for so long, and regardless of whether there's positives or negatives that have brought you to where you are with your identity, why is that like, why does that make something more or less valid? You know?
Absolutely. Also, just real quick, it sounds like your mic is maybe like a little close to your face. We're getting a lot of peaking, a lot of cracking. If you could just like, move
Is
it
this better?
a little bit. But
I'm talking.
sorry, go ahead. Okay. Yeah, sorry. I didn't mean to interrupt. I just wanted to make sure that the audience knows that we're aware that there's a problem, because if I don't, the whole chat's like, they're breaking on they're peaking on their levels, say something, and I have to jump in or whatever. So, but I really appreciate you bringing up this point, because I didn't even think of it in the moment, and I still stand by that. I don't think there's a lot of evidence to suggest that people are transitioning as a response to trauma. But even if they are, it's still not an argument against the efficacy of transition care or their autonomy and their right to just do something to their body because they fucking want to.
Yeah,
it's a really good point that I didn't think in the moment, and I wish I noticed it, because I've made similar points in the past, and it's a great place to inject that point. Would have been right after that call. So thank you for doing our job in making that point, because that is so great. I appreciate that a lot.
That was amazing. And like, I have to say, like, if you evaluated people's reasons for transitioning versus reasons why people pursue a career in medicine, like, I can guarantee, like, the majority of people that have pursued a career in medicine do not have good intentions or good reasons, and there's some pretty bullshit reasons why people become doctors. So it's like, but that's apparently a good decision, but transitioning isn't. So
yeah,
this is maybe just me being a little bit bitter about decisions to pursue medicine, but it's fine.
Yeah, I don't know if you're still there. I'm not hearing you now at all. I asked to fix things and I made it so much worse. Are you still there, Peyton?
Oh no.
Oh no, we've lost you. Fuck.
Hello.
Oh, there we go. Now we can hear
you're
you.
back.
Okay.
You're back.
No worries.
Back.
Yeah, sorry. My phone mic isn't very good.
That's
Next
okay.
time I'll use my good microphone. So I want to say two things about that. Number one, there's some interesting research. I don't know if you've seen it. That people who like engaged in gender non-conforming behavior. Sorry, what I want to say is that there's evidence to suggest that while there's higher rates of like sexual abuse, let's say, in gender non-conforming people, there's evidence also to say that they engaged in gender non-conforming behavior prior to sexual abuse. So I think it's like a really important conversation about like chicken or the egg, you know, like in terms of what that person was saying about like, well, did they, you know, these people are very abused and these sorts of things, and then they want to transition. It's like, well, let's look at some of the reasons that they were more vulnerable, right?
Yes, exactly. Yeah, no, that is a correlated mistake that people make all the time. They get it the complete inverse direction. No, you definitely nailed some points that I've thought of in the past, and I think I've even used before, but I did not use them in the moment where it would have been so useful. So yeah, I appreciate you bringing those points up, Peyton. That's really fucking helpful. And I think a thing that our audience needs to be reminded of sometimes, bop them on the head with some of this stuff.
Yeah, totally. Because like the thing is that while I don't think that being trans or gender nonconforming is a trauma response, I think it's just a human thing. Like, even if that were the case, why is that such a problem? And I find that having that conversation with people actually brings out their true opinions, which is not concern for, especially children, not concern for the trans person or the trans child, but actually just bigotry.
Absolutely. Yeah, no, it's so true. Yeah, and at the end of the day, like, bodily autonomy in my worldview is like a pinnacle of like where I frame a lot of my ethics around. Like, the right for you to self-determine what you want to do with your body, unless there's evidence to suggest that like doing so is going to be explicitly bad for you. Like I know in the case of body dysmorphia specifically, as Ben has pointed out, the research does seem to indicate that the problem is like internal, and getting these changes doesn't actually alleviate any of the problem or make you feel better. It can in some instances make you feel worse, or just move the problem to a different location, like a different locus. But like fundamentally, outside of reasons where it's like it's indicated that it would be bad to get this treatment, I don't have the right to tell anybody what kind of things they can and can't do with their body. And this is a thing that we respect in most of like the US and Canada and the UK and things like this. In most cases outside of like abortion and trans rights.
Yep.
As we've pointed out so many times, like you can't force a mom to give her freshly born child blood even if the baby's gonna die. You can't do that once the baby is out of the womb. But when it's in the womb, suddenly you have to force the person carrying the child to, against their will, do things. And when it's trans people, you don't have bodily autonomy. But in every other instance, we respect bodily autonomy. It's definitely a frustrating hypocrisy. And even though I didn't bring up those points, I think those kind of, what you put behind it, it's clearly informed by bigotry and not actually their stated reasons, is the exact same reason I went off on Olivia and the exact same reason I went off on fucking Pine Creek a second ago, because they've demonstrated when you point out the flaw in their reasoning and they say, oh, well, I still believe this thing though. It's like, okay, cool. Then you are admitting that you don't actually, as you said, Peyton, you don't actually care about kids. You don't actually care about their safety. You don't actually care about fairness in sport. You are bothered by trans people for whatever reason, prejudice, or maybe you're just a fucking idiot. I don't know. And
Cough, racism.
The what?
I said cough, racism.
Yeah, right. All these different things, and you just need to mask it somehow in a way that makes you feel like you're not a bad person.
Yeah.
Well, I appreciate your contributions, Peyton. I would love to talk to you longer because I really appreciate everything you had to say, but we do have to get on to the rest of these callers today, and I think we're totally in agreement about everything, so I don't even have anything to scream at you over.
Mm-hmm.
Yeah, I was going to say, luckily, you're not up for a debate right now.
Right.
Well, thanks so much for having me. And yeah, I've called in on the line a few times, but it's my first time on y'all's show. So thanks for doing the work you do. I know it can't be easy. And, thanks for existing also in like professional spaces as openly trans people. Cause I think like, I just, me existing as a trans, like, therapist in training has changed a lot of people's opinions on the validity of transness, and so I think that's also really important.
Yeah, absolutely. I think visibility does a lot more in most cases than a lot of activism. Just knowing a trans person, it's hard to be bigoted when you know someone personally who doesn't conform to your prejudices. But thank you again so much, Peyton. I appreciate you, and call back another time. We'd love to talk to you again.
Thanks. Have a great night.
You too. Bye. Dr. Ben, what is your schedule? Do you have something you're trying to get to, or like?
I mean, I got things I have to do tonight, but we can.
If you would like to move to super chats, we can just go to super chats. As much as I want to get to everyone in the call queue, we have limited time and resources.
I do have I got a project I have to work on tonight.
Okay.
For residency. But
callers can hear us right now in the queue. I'm really, really sorry if we weren't able to get to you. I think we kind of already answered like minimum age for trans, what age appropriate trans care looks like. I see that one caller in the queue wants to talk about that. But if you want to call back next week, we can give you more specific answers. And the other caller,
I can share a little bit about what I'm going to be working on tonight, though, because we got a bunch of like research-based things that we have to do for residency, and so this one basically, it's a bunch of like sifting through studies to find like data and then figure out how you're going to present this in like an academic setting to answer your own clinical questions. And so I'm going to be looking into the studies about cardiovascular disease risk in trans people on hormone therapy. So it'll be it'll be interesting.
Yeah, no, that definitely does sound interesting. I want to just say again, sorry to the callers we couldn't get to. The screener is going to talk to you and let you know you can call back next week, and apologize for that. I want to. Okay, we didn't do any of our announcements, which I'm usually kind of good about that. So you should know that while the Transatlantic show is obviously the best show on the line, I think as we've demonstrated for a thoroughly spicy episode, I mean, this is like the atomic bomb on hot wings level spice. There are other shows though. For example, this Sunday will be Matt Dillahunty and Jimmy Snow on the Sunday show. Then next week, looks like we have almost nothing scheduled. We were really good in like June, and then July was not as good, and in August we've got nothing planned. No, Aron Ra is going to be on Skep Talk next week, but we don't have a guest settled. Dave Warnock's going to be on Tuesday for Dying Out Loud. We don't have a guest settled. And Matt's going to be back on the Hang Up next Wednesday, where we also don't have a guest settled. And Takis team has not done any of our August scheduling. And I'm going to be gone for a trip at some point in August. So we'll get all that information to you guys soon.
Yeah, I'll be here for the last 2 weeks of August because, well, I will be
that's right.
delirious, Ben, for the last 2 weeks in August because I will be on night shift. And I've requested Thursday my day off on night shift. So I'll be working 80 hours those weeks and sleep deprived, and I will still show up for two episodes, Takis.
We're very grateful that you still find time for us amidst your busy schedule. If you want to support us, you can go to our Patreon, patreon.com/calltheline. That is the best way to support the entire network. If we get to, I think it's like 700 or 750, Matt's getting that Seth Andrews tattoo of a cat. And if we make it to the next goal above that, which I don't remember exactly what it is. I said 1,000, but I think that's wrong. We're going to be able to fund the LineCon next year, where we can have a whole convention to get all the Line hosts and all of you guys here to have a big fun convention talking about atheism and trans rights and activism and all those important issues. So definitely support us if you can. We're about to go into the super chat portion of the show, where if you donate a $5 or more super chat, we will read that out loud. And if you add hashtag Team Arden, you'll feel really good about yourself, is what I've heard. And maybe you can add hashtag Team Ben too. I don't know. Also, I was like,
comment, where's your evidence for that, Arden? Or is that just a correlation?
That's just my hunch. Like Olivia, I just had a feeling about it. Yeah. Also, I've just been noticing the live chat today has been full of people getting muted for saying stupid shit and then going, why am I getting muted? This is awful. You guys are so unfair. Take it to someone who cares. Literally, we apply the same rule to theists in all the religious shows. If you want to argue against our points, you have to call in. You don't get to have a sideshow in the chat and use our audience as a platform for your ideas. Call in or you get muted. You can have commentary on the show, but if you're asking provocative questions or saying transphobic shit, you're going to get muted, and I don't fucking feel bad for you. So I see Half-Life Zerka, whoever the fuck you are, being like, oh, you guys are muting me. I don't care. Cry to someone who cares, because it's no one here. None of our mods care. None of the hosts care. Go find someone who does. Oh, God, I'm so sick of annoying people today. You want to go first?
Am I? Yes, I can go first. $20 from Deanna. How is being trans different from other cases where people feel like they should be blind or have a missing limb? I'm an ally, but want to know if this is different. Also, if I submit 2 super chats, can I get a refund for one? I messed up. Thanks.
There's not a system for refunds. Yeah. We thought there was at one point, but there isn't. So be warned.
Sorry.
We can't do anything about that. I'm sorry. Sorry, Ben, did you want to answer how is it different? It's a hard one for you. I think you can do it.
I'm so sick of comments like this, especially the whole, like, I'm an ally, but this is not an ally thing to say, because these are completely different cases. Again, like, go back in the show where I talked about the difference between a mental illness and being trans. And for people who feel like they should be missing a limb, that is an issue that is possibly criteria for a mental illness, and being trans is not. And there's no data that suggests that this is a variation of normal, that you could like feel like you should be blind or have a missing limb. We don't have data that supports that. We have data that supports trans people. So
yeah, it's funny to me to ask, how is feeling transgender different from feeling you are blind or missing a limb? Deanna, with all due respect, I don't know you, and maybe this is me presuming too much, but I have a suspicion that you're smart enough to figure that one out on your own. What is the difference between these two things that are very obviously different in just the phrasing of the question? You got this one. I believe in you, even if you don't. I'm so, you can tell I have no patience today. Normally I come in here and I have a lot more patience, but I just, none today. $10 from Cyruso X Legion. I have a good friend who sometimes posts transphobic jokes. I tried to tell her that these things harm the trans community. She doesn't seem to understand. I don't know how to explain things to her. I mean, you could ask her to like call in, or I mean, it really depends on the kind of joke she's making. Sometimes I see people on social media overreact to things that I think are kind of okay jokes. There was a great one in the Barbie movie where she walks up to, I'm going to spoil, it's not really a spoiler, but she says she doesn't have genitals. And all the people there are like, that's okay. Like, it seemed like kind of a trans joke to me. And I thought that was hilarious, but some people might have been bothered by it. I don't know. I think it's just to be like, hey, trans people are humans. Or even be like snarky and like condescending about it. Like, yeah, I also hate trans people, right? Kind of like, to like rub it in her face a certain way. Maybe that can help. I don't know. Do you have any thoughts?
yeah. I mean, I kind of co-sign what you said, but
Yeah. Yeah. Okay.
next one, $10 from Frank. At work, so I can't watch the rest live, but giving a hashtag Team Venus because I missed seeing Ben on the show. Also, thanks for bringing attention to the BS that went on this morning, Arden. I don't know. These talk about the house thing. Okay.
Yeah. The hearing from the subcommittee.
Yeah.
And huge super chat, 100 pounds from Jackie Greenland. Jackie,
Wow.
Thank you so much. That goes so far. I really, really appreciate that. So after the silliness around my birth certificate, my gender recognition certificate arrived today, which is a big yay moment for me. So it's a renewal of vows where my wife wants me to be the bride next year who wants to come to this party. Hashtag Team Arden this week. Thank you. Jackie commented last week or the week before about how her GRC got rejected because her actual birth certificate was like, it was like the original was written by hand or something like that. And so they're like, we won't accept that. And it's like, but it's literally her original birth certificate. So yeah, I'm glad you got that fixed and that you were able to now renew your vows with your wife. I think that's really special, and I hope it's a wonderful ceremony.
Yeah, congrats. That's amazing. $4.99 from Cody Crow. These days, if I go on social media and yell at a bigot, I feel like I did something productive today. Good on you guys. Much love. Go fuck yourself, Jimmy/Arden.
I feel it. I'm not always convinced. I mean, I'm a hypocrite, right? Because I'm sitting here. That's what we've just done. I think it's a little bit different because we're soliciting calls on this topic and people call us. We're not making outgoing calls. I'm a little bit iffy on the productivity of going after bigots on social media. I think it's sometimes better to just ignore them and block them and treat them like you can have your little weirdo corner over there where you have like nobody who actually wants to talk to you. But I don't think every approach is right for every person or by every person. And if that's something you feel like you can do, then I think that's cool and all right. $4.99 from Claire. Hashtag Team Arden. It seems many anti-trans people online can't spell or put words together. Yeah, I mean, to be fair, I've made plenty of typos or whatever, but I think it's more of a, they're not sincerely invested in this topic. It's just what's trendy to talk about, and they have enough propaganda on their feed that they have a few common responses, like apologists. It's like dialogue tree. I don't know. It does seem like those things go together.
£5 from Sean Isherwood. I can't watch the rest of the show live. I'm traveling tomorrow morning. Have a good one. I hope my math facts don't distract from the show, by the way. Thank you for your donation again, Sean. My brain is not in math mode really ever right now. It's just mush. But I hope you enjoy your trip.
Yeah, likewise. And you definitely don't distract from the show. I think it's nice to be like, ooh, we got another Sean thing. How's he gonna confuse me with math words today?
No, I love it.
We're definitely not gonna hit 25 votes for the super chat thing today. We also haven't decided on a punishment though. So
we haven't.
We'll figure it out. $5 from Panda. Great show so far. # team Dr. Ben. Nice.
Yay.
Dr. Ben votes in.
$9.99 from Melody Kate. Embracing people for who they are seems super hard for some people. If parent rights override what books can be in a school library, then parents can get good medical care for their wee ones. Right? I mean, humanism is very hard for some people.
Yeah, I don't think this is exactly what you meant, but for some reason my brain interpreted if parents' rights can override what books is like, figure diabetes out for your kid on your own. Then if you're against science, you should just figure it out, right? Like, parental rights are the all-encompassing force of the universe. $5 from Laser Lizard. My first words out of my teacher's mouth on the first day of 9th grade science. All we know is we do not know. Shaped my approach to science. # team Arden. I mean, I appreciate the sentiment. Obviously, we do know some things, acknowledging that we can never have absolute certainty. But yeah, I mean, it's important to acknowledge a lot of people think science is like a guaranteed fact. Like they discover something that is an irrefutable fact about the universe, and like diabetes is an irrefutable fact about the universe. That's not how it works. Science is always refining a model of the world and trying to improve it and better inform future models. Sorry, hold on.
$5 from Trinity Essex. Ben, I think you're in my city. Be my doctor. Why the sad? Oh, the sad face because I'm not your doctor currently. # Dr. Ben. Well, fun fact, actually, I am. There's a page, like kind of a directory for LGBTQ affirming healthcare providers, and I'm on that page now because I put myself on that page. So the thing is, I'm at a military installation, so I pretty much only can see like people with TRICARE. But if people have TRICARE and find me on that directory, you can get an appointment. I'm just saying, you can do that.
Right on. Go see Dr. Ben. Just don't be parasocial and weird about it. Like, go if you actually want him as your doctor.
No, that's the other thing too. Like, if you enter into a professional relationship, like doctor-patient relationship, like it will strictly be a doctor-patient relationship, and just know that like that is not a friend thing. That is purely a professional relationship where I am doing my job and you are like expecting some service.
Yeah. We had a really weird parasocial thing happen here this morning. It was people need to understand boundaries and know that you don't know us just because you watch us on this show and we talk about ourselves. It doesn't mean you know anything about us. Sorry, let me do that and that. $5 from, sorry, I realized it's me, and then I was like trying to get another thing done. $5 from Whiskey Spirit Guide. Arden's teeth are brighter than my future. Either way, I adore both of you. Say fresh cheese bags. Thanks.
That's my new
I
favorite
guess.
gender neutral way to talk to people. Stay fresh, cheese bags.
I'm also realizing I didn't get a super chat in the queue. I want to make sure I didn't miss any others. Oh no, I didn't get Sean's actual math one. I missed it somehow. So let me send that right now.
5 pounds from Sean Isherwood. Observe 13 squared equals 169, and 31 squared is 961. The same thing works for 10 to the nth plus 2, and it's reversal for natural n. Good to see you back, Ben. Arden rules, but so does maths. Awesome.
I think
cool
maths are
facts.
pretty cool when other people do it.
Indeed.
Oh, and I missed a couple super chats. Let me make sure those all get in the queue. Okay, now we're back on track. This is $10 from Madison. Good to see you on the show again, Ben. Hope residency is going well. # Team Dr. Ben knows more about medicine than you do.
I love it. 5 pounds from Samantha Patrick. # Team Arden.
Thank you. I love making Ben read a Team Arden.
Look at that.
It feels good.
This one's you.
Oh, right. Sorry. $10 Australian dollars from Jackie Andronikos. I'm 2 months on estrogel. 1 pump low dose to start until the breast ducts finish developing. Then I was told to go to 2 pumps. Normal is 2 to 4. What are your thoughts on the low ramp up for HRT? # Team Arden. That's definitely a Ben question.
But I've never been on E, so I guess like it depends. It depends on a lot of things. Like normally it's gonna be slow because there is risk for certain complications, and it's good to make sure that like you're not getting too much and risking those complications like too quickly. But also, like I think there's a lot of data suggesting that a more gradual transition can often get people like more desirable results for them.
I've seen that too.
Just because a lot of how hormones work and convert to other hormones and all that stuff, like, and you have inhibitory mechanisms and all that. So I'm generally in favor of a slow ramp up. I know it can be painful to feel like you want more, but more isn't always better right away. So I think it's smart. But I know that there's some debate about that, and I can't necessarily say there's like a consensus on like this is the rate of transition that you should undergo. It's like very individualized. So you could find other people that disagree with that, and it's not something that's super clear.
Yeah, I think I've seen some of that evidence too, that gradual changes seem to have more desirable effects, but I don't really know much about it.
Yeah.
So. Word.
Something I can look into though.
Is this one you?
Is this me?
That's you. I think
it's
I
me.
read
$4.99 from Ramona. Extremely spicy episode this week. Dr. Ben, I was gonna give you a point, but Arden mentioned Barbie, and I have to support the dolls. # Team Arden. I saw Barbie too, though.
Yeah, and Ben liked Barbie. I'm gonna give us
Barbie.
both a point just because I have power and I can do whatever I want.
Yes, points for Barbie.
Points for Barbie. That's what that really is.
Yes.
I do love Barbie though. It was so fucking good. Outstanding.
Oh, it's so good.
We've got €10 from Thomas Donald Jacobs. I love the show today. So much today. Largely because of Arden's attitude. Thank you guys for all you do. # my cat stole my dinner. # Team Big Mayo. Thanks. I wasn't trying to come in here with an attitude. I just, in planning for the show, I saw the hearing that was going on. I was like, okay, now we need to talk about that. So let me do research. And then I was just like in a no tolerance mood for bullshit or for people saying untrue things and then not like actually being able to account for it or not being interested in accounting for it. Like, if you genuinely think all trans women should be banned from sports, you're wrong, and I think it's fucked up, but I think you're allowed to have that position. I just want to actually, you can't just say that on my show without pushback. And if you're going to cry about how I'm not giving you a chance to talk, try not being fucking wrong. And then you can talk a lot. There are plenty of callers who I've disagreed with, who I let talk for long periods of time, because they were respectful and they didn't try to push out a bunch of vague stuff that clearly led to a certain conclusion. So anyway, spice, anger.
Spice. Is this me?
Yeah.
$5 from Ligerman30. I'm cis but take tea, and I also take far more dangerous drugs, and yet I need an ID for tea and not for those. Is this to stop people getting care? There's a lot of things with this because because tea is a controlled substance, but there's not a lot of good reasons why it's a controlled substance, but that's like a whole kind of rabbit trail of a debate to get into. But yeah, no, I do see some issues with the way we're prescribing testosterone and like a lot of the regulation behind it. But
I'd be curious to know what other drugs you're taking, because my understanding is that estrogen doesn't seem to have a huge interaction with most other drugs, but tea maybe can in some instances, and maybe that could be why. But still, I definitely...
Well, and also tea is a lot more heavily abused than E is, but...
Right, by cis men.
By cis men. Yeah.
Yeah. Predominantly, anyway. $4.99 from Melody Kate. Ran out of characters. Should include from cutting edge medical community, so many states. Oh, did you send one earlier that I missed? Embracing people for who they are seems super hard for people if parents override what books get medical care for their wee ones. Oh, I see. You just wanted to reiterate that the care that they're getting for their little ones is cutting edge medical community. I mean, even then, I'm comfortable with people saying that, like, they don't think that the evidentiary status of trans healthcare for minors is super strong. Because I would agree that it's not as strong as some other things. But the problem is people take that and think, so we don't have enough evidence for trans care. No. You decide what medicine to give. Ben did a great point about this earlier about how we're doing a cost-benefit analysis. This is the evidence we have. These are the risks and the costs to doing it, and these are the benefits to doing it. And while, sure, the evidence could be stronger and the costs there may be some costs or risks, if the benefits outweigh it, that is all medicine. All medicine functions that way. And there are lots of other uncontroversial treatments that have a far weaker evidentiary status than trans people. So I would be comfortable admitting that the evidentiary status of trans care for minors is not as strong as some other medical things in the community. But that's not that it's uniquely weak. It's that a lot of things that are commonplace treatments are not as strong as other things. That's it's a wholly uncontroversial take to acknowledge that there's different evidentiary statuses for different things in medicine, and that we go with the best that we have. So
Yep.
I don't know. It's so hard. People can't be reasonable on certain things.
$5 from Emery King. Can we not be ableist and point out when bigots and transphobes can't spell? I'm dyslexic and trans, so those two things are not connected. LOL.
I get the point you're trying to make.
Yeah.
Sure. Yeah, it's probably something I should work on finding other criticisms of people to make. Fair argument. I will do my best to keep that in mind in the future. 1999 from Will-O-Wisp and some sort of astrological sign. When I was a Christian, I gave 10% to the church. Now I gave the same 10%, but to people or social awareness media like your show. Best wishes. Thank you, Willow. I appreciate it. It definitely, seriously, goes a long way for us in producing these shows that we are getting support from you all, and it means a lot. All right, and last one so far
5 Australian from Jackie Andronikos. Better results was what my endo said. I want good results, but also more. Also, thanks for what you both do. It's hard, but I appreciate you both. Thank you, Jackie. And yeah, no, that's something too. Like, I wanted to be on higher doses of tea earlier, but I understand that it was better to wait and ride out the titration. But yeah, it can be painful, and I understand that.
Yeah, I think also like the changes feel really slow at first, but then you also just kind of wake up one day and you're like, whoa, how did I get this far from where I started? I promise you will have a moment where you're like, wow, I have come so much further than where I started, and that like really makes you feel some kind of way. Oh my god, this dude is still crying in our chat about getting banned. What a whiny little bitch. I'm sorry you didn't get enough hugs and that getting banned from a YouTube chat is really hard for you. Your life must be so awful. A few more came in, just barely.
Okay.
Oh, this one's me. Sorry. $5 from Ligerman30. Since Arden was curious, I take lithium, which is literally toxic among other medications.
Yeah, that would do it.
Yeah, I could see that being a problem.
But it's also not a controlled substance, and not everybody's getting lithium. So like that's like you're really only getting lithium from a psychiatrist. So that's a bit different too.
Yeah, I hope there's better care, because I was at one point diagnosed with bipolar type 2, and I know you don't take lithium for type 2, but I remember reading when I was in psych and comparing my diagnoses to like all the psychotropic medications. Lithium has so many side effects, dude. It feels really dangerous.
Oh, lithium is so dangerous, and we've got some better options now. We're getting better treatments.
So I'm like, we're talking about trans healthcare as if it's dangerous, but people still take fucking lithium, dude. Like, come on, can we put our focus and energy towards improving medicine in ways that actually matter? Last one.
€5 from Ivan ZD50. Dr. Ben, can a cis guy take a teeny bit of tea to get a bit in shape quicker? Would that work? And if yes, what is a tiny bit, and how many tiny bits do you need?
Is he asking how to dose
it's
for
probably
sports?
Not gonna, like, technically you could. Is it going to do what you want it to? No. No, because you're also going to get some side effects because taking tea as a guy, if you don't have like low testosterone, you do face some risks of fertility issues and things like in cis men. So, and that's like a little bit might not be super harmful, but it's like, again, like it's these questions are always weird because like I can't really tell you what to do with your medical care, and it's very awkward for me to have to do that because legally it's weird. Talk to your doctor, and if there's a reason for you to be like because generally speaking, there are some conditions where you could be getting prescribed testosterone, and you might have that. You also might not. So talk to your doctor and see if they think it's appropriate.
Word. Well,
yeah.
We have come to the end of the show. It was full of spice and sugar and everything nice. It was full of whiny little people in the chat who were complaining about getting banned for being dumbasses. I had a great time smacking down annoying people today. I think it was really reinvigorating for the mood I was in when the show started. So thank you guys. Thank the mods, and thank Amargan for screening. I see Cookies and Amargan and Alyssa, and I saw Stephanie in here earlier. To all our mods for doing so much work, putting the diaper on. Oh, and Dylan, and giving a nice spanking to all these whiny little children who are crying in our chat. So I appreciate you guys so much. Ben, did you want to give them any little send off before we go?
Well, it's been great being here when I can be here, and if I just drop off the face of the earth, that's just gonna happen. Y'all gonna deal with it. And I guess little point that we talked a little bit about during the show, and Jimmy has mentioned previously, but I'm gonna bring it up again because I feel like it's very important. I'm already and Arden as well, and Katy as well, and everybody are already very, very overly stimulated just by existing and doing all this stuff. And as much as we want to help people out, this is the place where we do that. And this is the place where we answer your questions. And anything outside of that is a little bit inappropriate and kind of pushes those boundaries that I think like I need to set for myself, and Arden needs to set for herself, and Katy needs to set for herself. So as much as I want to be able to help everybody, please respect our boundaries. Please respect our like free time as humans. And if you have questions, bring them here. But otherwise, we'd appreciate it if you just like don't flood our DMs. Thanks.
Yeah, super true. If I had all the time in the day, I would do what I could to give you guys all like the studies and stuff. But that's something that like I would ask to be paid for, and I definitely don't have the time. I've got so many snakes in our care. We had 7 snakes hatched. Was it 2 days ago now? We had 4 last week. We've got another couple or another like 6 hatching in like 2 weeks. I've got so much on my plate and definitely no time to answer questions like that either. So much love to you all, and you'll probably see an event go up, and that's how you'll know who's on next week, probably at the same time that we know who's on next week. So see you guys all later. Bye.